I'm Cheyenne. I'm your student nurse today. I'm going to be the one giving your head-to-toe assessment and washing my hands. Now, may I go ahead and see your wristband and check your name and date of birth?
DeAndre Wilson, 9/13/90.
All right. Thank you, Mr. Wilson. Now, I'm going to start by inspecting your head, and we're just going to check for any abnormalities. I'm just going to gently palpate. Let me know if I have any if you have any tender spots. I'm sorry. Anything?
No.
Okay, good. And your hair is evenly distributed. There's no depressions, lesions, or infestations. Your head is normal cephalic. Your face is symmetric. There's no involuntary muscle movement or muscle weakness, no droopiness, which is good. Now I'm going to palpate your sinuses. This is your frontal, and this is your maxillary. Any tenderness? Good. I didn't feel any lesions or abnormalities there either. Now I'm going to check your eyes, which they are symmetric. If you can go ahead and look up for me, I'm going to go ahead and check your conjunctiva. Pink and moist. Your sclera is white and moist, which is good. And we're going to check your accommodation to light. Can you look over it? Okay. Okay, now follow the pen for me. This is 6 cardinal gazes. Okay, good. Your pupils are equally round and reactive to light accommodation, which is a good thing. They're both symmetric. I don't see any crustacean or anything like that. Nothing to worry about there, which is a good thing. Now we're going to go ahead and check your nose, which is midline to your face. If you look up for me, I'm going to check your mucous membrane, which are pink and moist. Your septum is intact. It's not deviated. I'm going to palpate. Any tenderness? Okay, now I'm going to check for patency. Can you go ahead and sniff? And sniff. Okay, good. No blockage there. Can you flare your nostrils for me? They flare symmetric. Thank you. And your lips are moist, and they're appropriately colored for your ethnicity. Can you open your mouth for me? I'm sorry. Okay, your teeth are white and straight. They're all intact. Your soft palate is pink and moist. And your hard palate is pink and moist. Your tongue is midline, and it's moist. Okay, your uvula is intact, and it's midline. And your tonsils are intact, but deviated, which is a good thing. Now I'm going to palpate your outside of your ear, which is your pinna. Any tenderness there?
No.
Okay, now I'm going to check your ear canal. Inspect your ear canal, I'm sorry. I'm going to pull up and back, and they're both clear from any drainage, no discharge or excess serum, which is a good thing. Now we're going to go ahead and inspect your neck. Can you lift your head up for me? Okay, good. Your trachea is midline. Your thyroids are non-palpable, which is a good thing. We don't want any enlargements of your thyroids. And I'm going to palpate your carotid, which is right here. This is the artery. I'm going to one side at a time. And now I'm going to ausculate, for bruits, which is blockage, stenosis, narrowing of blood vessels. And we'll check that with the bell. All right. Now your carotid is nice and strong. I would give it a 2+, which is normal, a nice strong heartbeat. Now I'm going to check your anterior thorax. We're going to check for respiration, just your lungs first. I'm going to place my hands on your chest. Can you deep breathe for me? And exhale. Good, thank you. Your chest rises and falls symmetrically. There's no visible pulsations. Your skin is warm and dry, which is a good thing. We want that. Now I'm going to go ahead and ausculate your lung fields. And I do that bilaterally. Okay, good. Your lung fields are clear of any bronchi, rales, and wheezes, which that's what we like. Do you do a breast exam? I know men do breast exams as well. You do it first thing after a shower on the same time each month. You just put your arm behind your head and go in a counterclockwise motion. Just kind of massage there. Feel for any sore spots, lumps, anything that's out of your norm. And then you kind of squeeze your nipple for discharge. And if you find anything like that, I would definitely call a physician just to check up with that. Because men get breast cancer too, believe it or not. Fresh out of the shower is the best way to do it. Okay, now I'm going to I'm going to osculate your part, which is between your second and fifth intercostal space. Okay. And now I'm going to osculate your heart valves. Your aortic, which is in your second intercostal space. Your pulmonary, which is in your third intercostal space. Your tricuspid, which is in your fourth intercostal space. And your mitral, which is in your fifth intercostal space. Okay, good. And your mitral is also it is located where your alpha pulse is, which is your maximum point of impulse. And that's a 2+, and they're all bilateral. Free of any dysrhythmias or murmurs. You have a real nice, strong heartbeat. And if you can go ahead and sit up for me, I'm going to check your posterior thorax. Okay. And your spine is midline. There's no signs of lordosis, kyphosis, or scoliosis, which would be an abnormality of your spine. And I'm going to osculate your lung fields. Just go ahead and breathe normally. And I'm going to check your right side. I'm going to go ahead and osculate your right side for you. This is your third lobe. All right, great. And that's also free of any rales, wheezes, or bronchitis, which is good. Now we're going to check your upper extremities. I'm going to check your skin, your turgor. I'm just going to give you a slight pinch on both sides. Okay, there's no tinting. Tinting would indicate dehydration, so you're hydrated, there's no lesions, and your skin is appropriately colored for your ethnicity, which is a good thing. I'm going to check your brachial pulse bilaterally. Okay, you have a strong pulse. And your radial, which is alongside your thumb, which is also strong. I would give it a 2+. That's where we want it to be. Now if I could check your nails on both sides, I'm going to check for clubbing, which there isn't any. And I'm going to check your capillary refills. Just push down. Okay, and it refills within less than 3 seconds, which is normal, which is what we recommend. Alright, and your nail beds are also pink. It doesn't like you bite your nails or anything like that. Now we're going to do range of motion. If you can flex up for me, that's flexion. And out, which would be extension. And if you could raise your hand above your head, abduction. And down to your side, that's adduction. And if you could put your hand straight out for me, we're just going to check your strength. Kind of face, palms up. Thank you. I'm going to press down, you push up as hard as you can. Okay, thank you. Now I'm going to, press down for me. Okay, it looks like your joints are nice and strong. Now I'm going to check your abdomen. I'm going to inspect your abdomen. And we're going to osculate all 4 quadrants. Okay, left upper, right upper, left lower, right lower, and left lower. Okay, good. And we're just osculating for all appropriate vowel sounds. They're not hyper or hypo. We just look for a nice even timpani, which is there. If it wasn't there, we would osculate for 5 minutes consistently just to make sure you have active vowel sounds, which you do. Now I'm going to palpate light and deep. First lightly. Okay, now a little bit deeper. Okay, so you do have bowel motility. You don't have distended bowels, abdomen, I'm sorry. And it's not hard, it's nice, soft, and firm, not too firm, not too soft. It's appropriate for your build. Okay, now we're going to go to your lower extremities. Alright, and I'm going to go ahead and check your skin. Okay, good. There's no breakdowns, no lesions. Your skin is warm to touch. and dry. There's not a lot of moisture there. Okay, now we're gonna do some range of motions with your legs as well. If you can bend your knees up, that will be extension. Can you do both legs for me? Okay, and out would be extension. Alright, and can you kind of spread them apart? That's abduction and back together. That's adduction. And I'm going to check your calves. They're nice and strong. There's no lesions or masses. I don't feel any abnormalities there. And now for your feet, I'm going to kind of slide these off of you. Alright. We're going to check your capillary refills here. 1 to 3 seconds. That's good. Okay, good. Less than 3 seconds. That's what we like. And I'm also going to palpate both of your pulses. The top of your foot will be your dorsalis pedis. Okay, you have a nice strong pulse. I will give it a 2+. And inside, in between both legs, around your ankle is your posterior tibial. And I'm checking these bilaterally. Alright, good. Those are nice and strong. Alright, so you seem to be fairly healthy. Do you have any questions? Do you have any questions?
No. So.
Alright, thank you, and I appreciate you doing the physical assessment with me.